rate. So how do we do it? The first thing I would say, in your benefit plans, as you think about health, as you think about people, you think about the populations, the people who live with you in your area, the people who have pain and suffering, you need to do three things for them. One, you need to do something on the left-hand side, on the health promotion opportunity. You need to take care of their cost. You need to take care of when they're in the hospital, when they get sick. Correlate. We're going to stop doing that. And then you need something on the right-hand side to help with disease management. Now I'm going to focus on the left-hand side. That's my bias, because that's upstream. That's where I think the opportunity is. There are three things you have to do. Number one, your superintendent, your administrators, finance people, HR people, you have to say health is important to our organization. If you don't, this won't work. You have to say it's important. Now all of you say that. Then you go shut your doors and go do what you do. Tell somebody else to do it. That's not good. Don't shut your doors. Health is important. And here's what we do about it. We drive every level of the organization is driven with a value around health. What do you do for health in your group? Every and then the next level, what do you do for health in your group? And we also have healthy policies. We have healthy procedures. We have smoking policies, wherever they are. We have cafeteria policies, wherever they are. We have vending machine policies, wherever they are. We have stairwell policies, whatever they are. The issue is, do your policies or your values, as you state your values in your organization, do your values, do your policies, do your procedures facilitate a healthy culture? Is this a good place to work from a health point of view? So that's number one. Number two, you drive it from the bottom with health risk appraisal. That's core technology. Everybody does health risk appraisals. They do health risk appraisal not because they can work harder for the district, but they do health risk appraisals to help their vitality. What is it about my vitality that I can be helped? From doing the health risk appraisal, what can I learn about how to improve my vitality so I can go bowling on Tuesday nights, I can play with my kids, I can play with my grandchildren, I can work past 5, whatever I have to do. You have to give incentives. You have to give resources for people. If they find something that they need help with, can you help them? And what can you do for them? And the third thing is just measure it. 80% participation over a 3-year period, and I'll tell you what participation is in a minute, and 70% low risk. And I will guarantee you your healthcare cost increases will not be what they are now. And your presenteeism and productivity measures will also be good. You don't even count on those yet. Another way to look at that, health risk appraisals, core technology. I think the first thing it is go to your offices and say, what are you doing for the environment in your district? What are your values and beliefs? What are your workplace policies and procedures? What is your health design? Have you got this connected to benefits? The second place I go, where people typically go, is stratification. Can you cluster your people, your individual stratifications? Are you low-risk people? Do you have policies and projects for low-risk people, for high-risk people? You talk to everyone. Everybody gets something. You can't ignore anyone. Everyone contributes to the culture. Everybody contributes to your group of people who have pain and suffering, the policies you're covering. You may triage them to other parts of the organization. They may need some financial help. They may need EAP help. They may need whatever help they need. You got to get them to the right spot. Third thing you do is have population-based management programs. You have total population, like know your numbers. Just what are your numbers? And then you all know your numbers. You go into a drawing, you get a free weekend in Detroit. And that would be a nice, yeah. Well, for me, it's a nice thing. Blood pressure, that's part of knowing your numbers. No weight gain programs. I don't ask people to lose weight anymore. I say, let's just don't gain weight. What happens if everybody in your district would not gain a pound over the next year? Would that be a success? That'd be a wonderful success. Because if you do nothing, you're going to gain 1 pound per person per year. That's what America is going. £1 per person per year. You can stop it in your district. No weight gain. So that's the second thing. So for a person to be a participant, they do a health risk appraisal, they do coaching sessions, and population sessions. And then they get their incentive. You need incentives. People are not ready to do this totally on their own. But that's the way it is in America. Sometimes we buy cars on incentives. We do a lot of things on incentives. We get our kids to do the dishes on incentives. We get our whatever we do, we use incentives. That's just part of our culture. Final slide. If you're going to do a health and productivity management program in your district, here's one thing I might recommend you about. First of all, you tie it to benefit environmental things. You're going to think about the environment. Do you have a healthy culture in your environment? And then you might have a health advocate that's going to drive people to the right spot. That could be a coach from a health risk appraisal. That could be a WEA counselor. How do you drive people to the right spot? You probably need a behavioral health people, EAP programs or something to help people. Somehow you got to get people help because we all need help. You may need electronic health portals. You may have ways for people to get information. A lot of free stuff out there. You may want to drive into one spot or another. You need health risk appraisal. That's core technology. You need fitness centers if possible, where people can exercise, be active. You need wellness programs to help people facilitate their ideas if they want to maintain healthy behaviors or want to learn some healthy behaviors. You want to keep track of your disease management, your case management, your absent management. Try to get them all in the same integrated system if possible, because I think the first day of an absent may be the leading indicator of a serious problem later on. So you get to those people, not because you're checking up on them, but you want to know what can we do as a district, what can we do to help you? I think that's important. Remember, the two key words here are integrated and sustainable. If you can't integrate all these things, if you have a medical clinic or a nursing clinic, that's helpful. If you can't integrate all these things, this won't work. You integrate all your data, you integrate all your resources. If you're in a siloed management, this doesn't work anymore. That doesn't work anymore. We've got to get out of that. We've got to share information. And it's sustainable. If it happens today, tomorrow, next month, next year, when you retire, if it still goes on, then it's sustainable. Then you know you've done your job. It is sustainable. That's as fast as I can talk. And I appreciate the time. Thank you.